Thank you so much for being here today. It is great to have you joining this class on finding emotional safety, healing trauma through EMDR therapy. My name is Jarrett Romano. I will be your presenter for the class today. Welcome, and today we're talking all about the practice of eye movement desensitization and reprocessing therapy. I'm going to cover the aspects of EMDR. Some of you may be familiar with this and have heard of this therapy before. Others are maybe brand new to it, so I'm looking forward to getting a chance to go over it and explain it to you. We're also going to be talking a little bit about trauma in this class because EMDR is one of the leading therapies in healing past unresolved trauma in our lives. So we'll be covering several different topics related to trauma as well. Before I get started with that, though, I do want to introduce myself a little bit more formally in case you have not been to a class with me before. And if today is one of your second or third classes with me, because I did have this is my third out of three classes today. So I'm sorry that you're hearing my introduction again and again and again. But for those that have not been here before in a class with me, this is a little bit about me. My name is Jared. I'm a full-time therapist here on the BetterHelp platform. I do provide individual therapy. I also facilitate some support groups here on BetterHelp and teach a bunch of classes here on the platform. I've been in the field for 9 years working as a therapist. I've been here on BetterHelp for 6 years. I also started my career as an addictions counselor, working with folks struggling with severe substance addictions, but very quickly became interested in helping folks to heal from trauma. So, over the last almost decade now, I've been working with a lot of clients on trauma healing, and EMDR is definitely one of my favorite tools out there for healing trauma. And I'm really excited to share a little bit about it with you today. I am licensed to practice as a therapist in the states of Pennsylvania and New Hampshire here in the United States, and I am joining you all from the beautiful state of New Hampshire, where it is bright and sunny on Saturday afternoon. And I'm really glad to be here with you all. And thank you for joining from wherever in the world you are today. It is really great to have you here on a weekend with me. Thank you. Okay, folks, here's what we're going to cover over the next hour. We're going to talk about some important aspects of trauma. Why is that important? Because EMDR is a trauma therapy. So I want to go over a couple key aspects to understanding trauma, and then we'll get into our overview of EMDR. We'll talk about the tool that's used in EMDR called bilateral stimulation. So if you see me going like this is just my reference to bilateral stimulation. This is what most EMDR therapists do for bilateral stimulation to have their clients follow their fingers back and forth. But we'll talk a little bit about what that is. We'll look over the 8 phases of EMDR, and we'll finish up talking about EMDR with online therapy and some resources on how to find EMDR therapists. One of the questions that everybody asked in this class is, can EMDR be done in the online therapy setting here on BetterHelp? And the answer is yes, it can. In fact, studies in the last several years have shown that not only is EMDR in the virtual therapy setting possible, but that it's just as effective as in-person EMDR sessions. So that's something to just keep in mind. And I usually get that question here. So I just like to say that off the bat that yes, it is highly effective even in the virtual therapy setting. Okay, so a couple things to share before we get started. Number one, if you have questions in today's class, feel free to ask them in the chat box. I've enabled the question and answer feature. Just please make sure to put a question mark at the end because it puts a nice blue box around your question for me, and I will pause in between sections and take a few questions each time. I will promise to answer as many questions as I can. If I don't get to them all, I apologize ahead of time. I do want to make sure that we cover all of the material today. Second, everybody will have access to the recording of today's presentation. That's going to come to you in an email later today, so look out for that if you want to rewatch this class. That recording is available to you for the next 7 days. Finally, if you're joining from a browser with a computer, you may be able to enable or disable the transcription. I do know that smartphones and tablets don't have that option, but if you would like the transcription on or off, you can change that in the settings button under the little gear symbol on your screen. Also, if you want it on, but it's blocking any information on your slide, just click the transcription box and move it somewhere else on your screen so that it doesn't interfere with any of the information on your slide. Okay, so with that, I am going to get started here. And our first topic is the foundations of trauma. So One of the things that's important to understand is that there have been some pretty significant shifts in how we understand what trauma is. Because when I start talking about EMDR and trauma therapy, a lot of people assume that we're doing trauma therapy only when there are some major catastrophes in somebody's life that we once thought was how you define trauma. In fact, let me take you back to the year 1980 in the third edition of the Diagnostic and Statistical Manual of Mental Disorders that defined post traumatic stress disorder and trauma as a catastrophic event outside of usual human circumstances, such as war, natural disasters, and human made disasters. Today, we know that potentially traumatic events are actually far more common than what we typically think of as big catastrophic events. Now, one of the things that I do want to distinguish is this: there is a difference between unpleasant events and trauma. So, we do experience a lot of unpleasant events in our lives as human beings. Now, how do we distinguish between something that's just unpleasant and something that's just traumatic? Unpleasant events are those things that we tend to cope with very well, right? Trauma is something that is intensely painful, and there's no foundation of emotional safety and security when that painful event is happening that allows us to process the pain from that event. So let me give you an example of this, right? If I'm sitting in traffic and I'm late to an appointment with my doctor, and I tell myself, this is not a big deal. It happens sometimes. I'm going to call the doctor's office and say I'm going to be 10 minutes late. The doctor's office says to me, no problem. We'll see you when you get here. Thanks for letting us know. And although it's annoying and I'm a little bit frustrated because I like to be on time to that appointment, I feel okay and I've coped with it well. Let's say I'm in that same situation and I'm late to my doctor's appointment and I start to have a panic attack and I start to tell myself that I'm a horrible person because I'm going to be late to this appointment and how I should have known better and to leave earlier. And I start having these strong emotional responses and start shaming myself and saying that I'm a failure because I can't even get to an appointment on time. I may be having a post traumatic stress response. Same situation. One person is not triggered by it. The other person is triggered by it because it's connected to something deeply painful for them. And that leads me to tell you that I can't give you a definition of what is definitely unpleasant in someone's life and what is definitely a trauma in someone's life because it's going to be based on your own individual experiences in your life. Another thing that we need to keep in mind here is that trauma doesn't always look like a giant major catastrophe. It's not always a natural disaster or going to a combat zone. A lot of times, trauma is more subtle, repeated versions of painful experiences, such as abandonment, invalidation, breaking your trust, different forms of abuse, emotional neglect, emotions being punished, emotional needs not being met. These are all potential forms of trauma that set the stage to be wounded, which is what a trauma is. It's a wound. And as we repeatedly experience these situations in our lives, we may not have the emotional safety and security to process the pain from these experiences. So, one of the things that Bessel van der Kolk points out in his book, The Body Keeps the Score, is that when you have a repeated exposure to some of these more subtle forms of trauma, you're starting to experience what we call complex and developmental trauma. This can happen over the course of our lives. This can be from repeatedly feeling abandoned by our caregivers, repeatedly feeling wounded or hurt by those around us in ways that aren't always obvious to us, sometimes in ways that we even call normal in our society, which is really scary. The other thing that I heard Bessel van der Kolk say is that sometimes a natural disaster or a major catastrophe isn't traumatic for somebody. So, what's an example of that that he gives? He said that several years ago, in his community where he has a cabin in the state of Vermont here in the United States, they experienced extreme flooding and the whole community was wiped away. He said a lot of the people that experienced that developed resilience and didn't develop post traumatic stress responses because the community came together to support one another in such a painful time. And so, because of crisis counselors being available and the community helping one another to go through that painful event, they were able to process it and not develop post traumatic stress, even though you might think that a natural disaster like that would give somebody post traumatic stress, right? So it's all depending on how much safety and security to process this pain that you have, right? And I think that's really, really important for us to understand, right? Now, just to give you an idea of what we are treating in EMDR therapy, we are trying to help the body reduce the emotional charge that's connected to a trauma so that these post-traumatic stress responses, which essentially are cues to the present environment that remind us of images, negative beliefs, sensations, and emotions from a past trauma, become less and less impactful in our present life. So essentially, we are trying to reduce the impact of post-traumatic stress responses and trauma cues in the body. That is our goal through EMDR therapy. We do that through reducing the emotional charge of a trauma. Secondly, we're also trying to help reduce the impact of complex and developmental trauma. So, one of the things that we do in EMDR is if we have a lot of repeated exposure to the same traumatic events that we've mentioned, so abandonment, invalidation, abuse, lack of emotional support, emotional neglect that we talked about. One of the other things we do in EMDR is we try to bring those different types of events into a theme. We try to understand it through a theme so that we can connect different events in our lives, right? So, one of the things in EMDR that we don't want to do is we don't want to try to just reprocess traumas from the beginning of our lives up through the present without connecting them to something if we have complex trauma. So, when we do EMDR for complex trauma, we're going to take a theme based approach. And if you're wondering what a theme is a type of event. Like, let's say we experienced a lot of abandonment in our lives. We may work on the theme of abandonment in EMDR. Or let's say a lot of trauma came from our caregiver, mom or dad. Mom could be a theme, or dad could be a theme, for example. So themes are what represent a collection of traumatic experiences in our lives. That's really what we're focusing on in EMDR when we do a theme based approach. Okay, so some questions here. Let's see. Can you do eye movements on your own without a therapist? Is it effective? Yeah, thanks, KY, for mentioning that it's something that is not typically advised, and that is true. It is definitely recommended that we practice this with a therapist because while this is very powerful and very healing in its nature with EMDR, sometimes our body tries to push back on processing the emotion, right? So, especially if you struggle with dissociation, if you struggle with numbing emotions, a lot of times the body can say, no, 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 we don't want to go there. The limbic system, which is the survival part of the brain, might try to push it all back down again in order to suppress those emotions. So, the body can be very resistant to feeling and processing emotions. And it takes a very skilled, trained therapist to know how to help work through that experience, right? So you wouldn't be able to know that if you were trying to do this on your own. And that can be very distressing for some people. So we have to be very, very careful about that. So it's very, very recommended to do this with a trained EMDR therapist 100%. Let me see here. How do you distinguish if it's trauma versus haven't let go of something? Well, that's an interesting question, AL. The thing is, I think if our body hasn't let go of pain, that is somehow correlated to a trauma or it is a trauma itself, right? So I don't know that I would even make that distinction. I think if our body's holding on to emotional and or physical pain connected to some painful experience in our lives, that would probably fit the definition of trauma. So I don't know that I would even make that distinction, to be quite honest. And if you were saying to me, Jared, I have this, event in my life and, I really wanted to let it go, I would say, well, this is exactly what we have EMDR for, right? So we could call it trauma, we could call it painful events, we could call it, um, uh, discomfort in the body, whatever it is connected to something very painful, and it's likely going to fit the definition of trauma. So again, I don't know that I would even make that distinction. I would just say, okay, if our body has struggled to let it go, and that means it's still deeply painful for us. So we would probably do EMDR therapy with it. Good question. Interesting. I've heard many say that trauma got worse during EMDR, but after they felt so much better, even years later. Yeah, so here's the thing, right? EMDR can, yes, be challenging. What I don't want anybody to think or assume is that somehow this avoids the processing of pain. It does not avoid the processing of pain. What we're going to talk about, though, is how this differentiates between some other traditional trauma therapies. EMDR does allow us to feel our feelings, but it does so in, I think, a far more safe way and a far more constructive way than a lot of other trauma therapies do. So, yes, there are moments of feeling pain. And yes, a lot of people feel like they might want to step away from that, but that's actually our body doing what it typically has done, which is to suppress the pain. And we have to ask ourselves this: do I want to spend the rest of my life suppressing the pain, because you can definitely see what some of the negative impacts of that have likely been. A lot of times, no, we might not be actively thinking about the trauma, but our body is doing a lot of strange things because that pain has remained unhealed. So I think that's a really, really important aspect to highlight. So thanks for saying that, KY. Very, very important to highlight, and definitely makes sense. Absolutely. So I'm glad that you said that, and you got it, MY. This is us allowing our body to finally feel the feelings. Now, here's what I will say: you need a safe environment to do EMDR. So one of the things is, if some therapist is trying to force this to happen and you don't feel safe enough in that situation, then yes, there is potentially going to be some negative reactions. But part of EMDR is to set up a safe environment to do EMDR. Well, let me say this: as a trauma therapist, my whole main focus in any trauma therapy with my clients is to set up a safe environment. That is the number one most important thing. So there definitely has to be a sense of safety there. Another good point as well. Okay, let's just talk a little bit about an overview of EMDR and what it is. EMDR is a mindfulness based and trauma focused treatment that helps both mind and body reprocess and resolve past traumatic events. That is what EMDR is by definition. Now, EMDR is different than cognitive approaches to healing trauma, because in cognitive therapy, what you're trying to do is you're trying to challenge a belief system that stems from the experience of trauma. Now, if we are just trying to tackle an unpleasant event that is not traumatic, I think cognitive strategies work very well. However, if your body is triggered, I think it's very difficult to challenge a negative belief when your body is in survival mode. So, for example, if I'm feeling unsafe, the cognitive strategy may be to say, well, challenge that feeling of not being safe because it's stemming from past trauma, and challenge that thought with, I am safe now. Well, that sounds good on paper, But what if my body doesn't actually feel safe? I always say that cognitive therapy tries to skip steps where you're trying to convince yourself that you're not actually experiencing the negative belief that you are. But when you're triggered, your body actually feels like that negative belief is real and true in that moment because it feels like it's back in the trauma. That's actually what's happening to your body in that moment. So that's why cognitive therapy falls short for reprocessing trauma. Another popular trauma therapy is called prolonged exposure therapy. Now, what prolonged exposure does is it has you retell the trauma and the details of it over and over again in hopes that you'll be desensitized to it. Unfortunately, prolonged exposure is incredibly hard on the body. EMDR certainly can be uh, painful to work through a traumatic situation. So it's not that EMDR is like this experience where you don't experience any pain at all. But prolonged exposure can be very, very risky because what a lot of people end up experiencing is actually reliving their trauma rather than reprocessing their trauma. So there is a huge difference between reliving something and reprocessing it, right? So, folks, EMDR is not prolonged exposure with bilateral stimulation. That is not what this therapy is. You are not saying the details of your trauma over and over again while your therapist provides you with bilateral stimulation. In fact, that is shown to be ineffective, not effective at all. EMDR focuses on your body as it is experiencing the present moment. EMDR is a present oriented therapy. So, what do I mean by that? I mean that the only part of the trauma that is relevant to our therapy with EMDR is the worst part of it, in which you are not repeating over and over again, but only bringing up into your conscious memory so that we can help identify how that trauma is still impacting you in the present. So, one of the things your therapist will say is, okay, do you know what the worst part of the trauma is? Yes. Tell me about how that affects what you believe about yourself now, what emotions you feel now, and what body sensations you feel right now in the present. So, one of the things your therapist is constantly saying in EMDR is, what are you noticing now as you do rounds of bilateral stimulation? Because we want to keep one foot in the present. We want your adult present self to reprocess something from your past. That's what helps us separate past and present. That's what helps us say at the end of EMDR, I know that this happened and my body knows that it is over now. That is the key distinction between these two things. I know that it's helpful and I know that it's over. And KY, you are spot on. It is more somatic than cognitive and prolonged exposure based trauma therapies. That is exactly right. This is keeping us grounded. This bilateral stimulation is keeping us grounded in the present. And we'll talk a little bit about that in just a couple of minutes. We're doing two things with EMDR. Once we reduce the emotional charge of the trauma, we are able to actually believe in the positive adaptive belief. So I wasn't able to cognitively convince myself that I'm safe now, but now that I've processed the trauma, my body actually feels safe now. And we're also allowing the body to first feel safe so then the mind will feel safe. In cognitive therapy, you're trying to use the mind to convince the body that it's safe. This is doing it the other way around. This is having the body first feel safe so then the mind can feel safe. So then those positive adaptive beliefs can actually be felt in a meaningful way. That's our goal with EMDR. If you're curious to know what's happening neurologically, what you're actually doing is you're taking memories from back here in the limbic system where survival memories are stored, trauma memories are stored, and you are moving them to the frontal lobe so that they could be stored in connection with a time and a place. One of the things that's different between the limbic system and the frontal lobe is that the limbic system does not tell time, okay, and the frontal lobe does tell time. So when we transfer a memory from the limbic system to the frontal lobe is able to store it properly and say this memory has a time and a place, right? Versus when we're triggered, our body believes that we're back in the trauma again. So that's what's happening on a neurological level with the process of EMDR. Okay, so one more thing, and then we'll talk about bilateral stimulation. A lot of people want to know, how do I figure out what I need to reprocess? So, the first thing that your EMDR therapist is going to do is they're going to spend some time with you. First, of course, establishing safety in the therapeutic relationship, number one. Number two, they are going to help construct your life history and your experiences to be able to identify the themes of trauma that you have to work on, right? So this is the key, is getting to the themes of trauma. Now, how do we do that? Well, we take the symptoms, triggers, and stressors, and maybe you have a diagnosis as well that you experience in the present, and we understand how the past is informing all of these things, right? So, this is what brings you into therapy, and then your EMDR therapist helps you connect that to how your past experiences have influenced these things, right? So, when you are reviewing your history with your therapist is looking for themes to identify. So, for example, perhaps a lot of people that were supposed to take care of you and be there for you didn't show up for you. So, you have the theme of abandonment in your life, right? You've experienced lots of people that were supposed to take care of you, and instead, they never showed up. They weren't there for you. Wow, I'm really struggling to write this with this little pen here. Okay, I need to start over again. Let me get my eraser out here. There we go. Boy, it's really hard to write with this thing, folks. Okay, that is not the right tool. Let me erase this too. Okay, here we go. There we go. Abandonment. Boy, they should really make this easier. There we go. We want to work on the theme of abandonment. So, this is just an example of many themes that could exist, right? What your EMDR therapist is then going to say is, okay, over the course of your life, based on these experiences of abandonment, what did you learn to believe about yourself? So, what you might tell your therapist is, well, based on these experiences of abandonment, I learned to believe that I'm unloved, I'm unwanted, and that I'm alone in the world. And your therapist will say, okay, which one of those hits the hardest right now in your life? And perhaps it's I'm unloved. So your therapist says, okay, we're going to start working on memories that are connected to the theme of feeling unloved. So what your therapist is going to help you do, and I like to just put little quotes around the theme here, or the negative belief, I'm unloved, because this is what we say to ourselves. So what your therapist is going to say is, okay, tell me about the earliest experience you can remember feeling unloved due to abandonment. Tell me about the worst experience you can remember feeling unloved due to abandonment. And tell me about a most recent experience. You're going to start reprocessing those memories. Why? Because your limbic system with unhealed trauma is like an 8-lane highway with a major traffic jam on it, right? And instead of trying to get every car stuck in that traffic jam around one at a time, which would take forever, we can just clear out the points that there's bottleneck. We can just clear out the points where maybe there's a car accident, right? And so all these other things all the cars can start to flow again along the highway the way they're supposed to. So the reason that we pull out these memories in particular are to help clear space so that other memories under this theme and belief allow you to process them naturally. So, what people start to realize over time in EMDR is the more memories that they process under a specific theme and belief, the more other memories that are connected to that also start to process naturally without even having to do EMDR, because you're clearing the space between the limbic system and the frontal lobe. Now, you might do 4 or 5 or 6 or 7 memories under a particular theme. It really depends on how big this theme is, right? But no matter how many you do, you're clearing out space for all other memories to start flowing through again. And by the way, maybe you do a theme, you work on a theme for a couple months with your therapist and you reprocess like 5 or 6 memories, you feel pretty good about it. You go and do other work for a little while. You can always come back and you say, hey, there was one more thing I thought of that came up recently. I should probably reprocess that, but we already worked on abandonment. That's okay. We're going to go back and we're going to do it, right? We have that flexibility. So another thing I want to mention is this doesn't have to be the first time you remember, or I'm sorry, the first time that it ever happened. It can be the first time you remember feeling this way based on this theme, right? So we might not recall the very first time, but the earliest that we can remember. Now, a couple variations to this are pretty cool to think about. So let me just go over those and then we'll talk about bilateral stimulation. One of the alternate protocols in EMDR is called the representative memory protocol. And what we do with representative memories is if you have a traumatic experience that happened over and over and over again in your life. So let me give you an example about that, right? Let's say dad always came home from work every day. He was drunk because he drank after work and he started verbally abusing everybody in the home. And let's say that happened every day after work. And I'm your therapist, and I ask you, oh, we're working on the theme of dad. We're working on feeling unsafe around dad because he did this. And I ask you, tell me the earliest, worst, and most recent experience that that happened. And you say, well, Jared, I don't know the difference between those because it happened every single day. Every day was the worst experience, right? I would say, okay, let's reprocess this. Let's reprocess an image of dad coming home and verbally abusing everyone in the house. Let's reprocess that representation of this because it happens so often that what your brain probably did was make it all one giant long memory, right? So you can actually do a representative memory, which processes a lot of information all at once. That's one variation of this. Another variation of this is what if you ask me as your therapist, Jared, I know that something happened to me as a child, but I don't have a visual conscious memory of it, but it still impacted me because I heard about it all my life. So let me give you an example of this. I had a client many years ago that I worked with, and she always lets me share this story when I talk about EMDR. She was adopted at the age of 1, and she was adopted by abusive parents. So her story since birth was, "I've been unloved since birth because my biological parents didn't want me and my adoptive parents were abusive." Now, she didn't recall visually being adopted at the age of 1, but that was a part of her story all of her life. So what I did was for her, I said, "Can you imagine what it would have been like as a 1-year-old being adopted to abusive parents?" And she said, "Yes, I can imagine those feelings." And we reprocessed it that way by imagining what that would have been like. Very cool variation of EMDR as well. Last but not least, EMDR has what's called a future scenario reprocessing protocol. What is the future scenario protocol? After you've worked on a theme for a while, so let's say you've worked on this theme of abandonment, feeling unloved for a while, what your therapist would ask you is, can you imagine a future situation in your life that's realistic, where you may be triggered by abandonment and feeling unloved? And you might say, yes, I can imagine a friend not calling me for a couple of days and me believing that they don't want to have a relationship with me anymore and just spiraling out of control. Okay. Can you imagine what that would feel like? Yes, I can. We would reprocess the future imagined scenario to further strengthen this. And what happens for a lot of people that do future oriented reprocessing is they feel even more confident to manage those triggers and post traumatic stress responses. So that's, I think, a good way of integrating all of this once once we've done a lot of work on the past. So that's called future scenario reprocessing, another powerful tool in EMDR. Okay, let's talk about bilateral stimulations. Oh, no, before I do that, let me answer this question from MY. Is that why my husband's death feels like yesterday when it's actually been 11 years? Absolutely, MY. I think you are spot on with how this impacts us because the body is feeling like that trauma is happening right now still, right? And I just want to express how sorry I am to hear that that is, is has occurred in your life and how much you've been struggling. And if you were to ask me, is EMDR right for me? Absolutely. I think this therapy could be incredibly powerful for that. But yes, that is why the body feels like it just happened for that very reason. And a very good question. Thank you for being courageous enough and brave enough to share that here in the class. Okay, folks, let's talk about bilateral stimulation because you keep seeing me do this. So, what is it? What is this tool? Okay, bilateral stimulation is stimulation alternating to the left and the right side of the body. So, we actually can do bilateral stimulation through several different modes. One is eye movement, where you follow a stimulus back and forth with your eyes from left to right. One is audio bilateral stimulation, where you listen to a sound that goes back and forth in your ears. Another form of this is tactile stimulation, where you're actually tapping on or touching alternating parts of your body like this to provide the bilateral stimulation. When I did this in person, I used to use tappers. They were little buzzers that you held on to and they vibrated back and forth in your left and right hand. They actually do make those for virtual EMDR therapy now, which is pretty cool. You plug them into your USB port actually, and your therapist can control them with a program from where they're at. So, what does bilateral stimulation do? Okay, I want everybody to think about what you would do if you had a screaming, crying infant baby that you were trying to soothe. What would you do with that baby? You would pick them up and you would either cradle them like this or you would put them on your shoulder and you would start to rock your body back and forth. Why are you doing this? Because you're an EMDR therapist. No, that's not why you're doing this. Because there's a natural understanding in our body that this is very soothing motion, right? Has anybody ever had a child that only ever falls asleep in the car and you can't get them to fall asleep anywhere else? Guess what they're experiencing in the car? Bilateral stimulation. Now, what is this doing to our body? It is soothing the limbic system and helping us feel safe. There is a natural proclivity for our body to feel safe when it experiences bilateral stimulation. This is why, if you're in a group of people and you start to feel nervous in that group of people, you start to do this, right? Rock back and forth. If you are in like a stressful environment, let's say you're in a job interview, you might tap your feet up and down to soothe your body. All of these are different versions of bilateral stimulation. So, in order to soothe the limbic system, we use bilateral stimulation to keep us grounded in the present. Because without that, if we start just talking about a trauma, our body becomes emotionally charged. We can be triggered and immediately be right back into the trauma, reliving it, re traumatized. Bilateral stimulation is keeping the body grounded in the present through that natural proclivity to be soothed by bilateral stimulation so that the limbic system can remain at a calm, collected state and allow for the processing of this trauma to happen in a way that it didn't happen in our past. It helps the system feel safe enough to process this trauma. So, I have three young children. They're 5, 3, and 1 years old right now. And they all went through this process of when they were very young and they were upset. I would pick up my children and I would rock them back and forth. And I would say, I'm giving you BMDR right now, baby movement desensitization and reprocessing, right? I think I invented my own therapy. Um, and I would tell them, it's okay. You're all limbic system. Don't worry. This is going to make you feel better, right? And all of my children grew up hearing that they were all limbic system, right? And but in a soothing way. I tell them it's okay. because we were all there at one point in our life, right? All of us were all limbic system at one point. But babies love bilateral stimulation. So do we as an adult. We do it all the time. So basically, what Francine Shapiro did when she developed EMDR therapy is take this natural um, soothing mechanism and apply it to healing trauma. So it's really, really powerful. And this is how bilateral stimulation works. Would this work for sexual abuse and sexual trauma? MA, not only would it work, but it's often the recommended therapy for people that have experienced that kind of trauma. It's very powerful. And I personally have worked with several clients over the years on that particular type of trauma using EMDR for their healing process. And it's very, very powerful for them, incredibly powerful. So, let's cover the 8 phases of EMDR. Okay, so if you choose after today to pursue working with an EMDR therapist, that EMDR therapist should understand all 8 phases of this therapy. There are a lot of people out there that are not getting properly trained in EMDR. They're just reading about it and then they're trying to provide it to their clients. Folks, I want to say this. It's a really good idea that when you get paired up with an EMDR therapist, to ask them to explain these 8 phases to you so that you can make sure that they understand the process as well. Because if they can't explain these 8 phases that you're going to learn them today, then they are not following the proper protocol for EMDR. This is what it should look like. Obviously, not all EMDR experiences are the same because we're working on different traumas, but the phases should look like this, right? So I want to go over those with you so you know what to look for in a good EMDR therapist. Number 1 and 2 is the history taking and resourcing phase. So before we ever get into reprocessing anything, we are taking history and we are resourcing and preparing for EMDR. In the history taking phase, you are learning to build trust and safety with your therapist, and you are working with your therapist to map out your past so that you can highlight those themes and negative beliefs and events that you want to process in EMDR. In the resourcing phase, your therapist is helping you build coping skills such as grounding or mindfulness skills to help you more fully experience and tolerate painful emotions and sensations that come up in the present because of the triggers from the trauma that we experience. This opens the potential for us to effectively reprocess the traumatic events in our lives. So the resourcing phase, sometimes it's called preparation, by the way. So if you ever see this labeled preparation, that is also the same phase. And it's preparing to go into the reprocessing with EMDR in order to allow our body to fully feel emotions. Okay, so when you are ready and with your therapist to move into EMDR, you will begin at the assessment phase. This is the beginning of your EMDR session. And here's what the assessment phase helps us do. It helps us cue up the charge of the trauma, but we're not focusing, again, I said this earlier, on reliving the trauma, right? So, what you want to cue up at the beginning here is just the worst part of the trauma. And by the way, I don't even make my therapist, I don't even make my clients tell me this if they don't want to. As long as you know what the worst part of the trauma is, that's all that matters. Worst part, what's the negative belief? What's the positive belief we want to feel about ourselves instead? And what's the emotion and body sensations that we want are that we're experiencing now due to that experience of trauma? So let me give you an example of how we would start this using the map that we already created earlier. Let's say I'm working on the theme of abandonment and I decided that the first memory that I want to reprocess is a parent invalidating my emotional response, feeling abandoned emotionally. right? So the worst part of the trauma may have been when my parent told me that I shouldn't be feeling the way I'm feeling. The negative belief was that I'm unloved because they couldn't hold the emotional space for me. The positive belief is I can hold space for myself now. Be very careful with this. We don't want the positive belief to be something that is reliant upon the other person that has hurt us, right? So my positive belief would not be that my parents do love me or did love me in that moment, because I don't know what they were feeling in that moment. And I certainly don't want to rely on them to allow me to process this trauma. I want instead to know that I can provide myself that space now. And what are the emotions and body sensations when I bring this up? Maybe fear, maybe constriction in my throat from being unable to express myself, maybe anxiousness or nervousness. And then your therapist is going to say, okay, as you feel this in your body, I want you to notice whatever you notice as I begin the stimulation. And they're going to start the bilateral stimulation. That is phase 4, which is where you're doing sets of bilateral stimulation from about 30 seconds to a minute long. When your therapist stops in between those sets, they're going to have you take a breath. They're going to ask, what are you noticing now? And as you notice something, your therapist is going to say, just notice that. And they're going to do more bilateral stimulation. And what's happening in your limbic system is connections are being made, and your body and brain are able to start understanding that this experience is in the past, and it's being moved into the part of the brain where it belongs, the frontal lobe, so that it's connected to time and place. So, what kind of things start to happen in phase 4? Clients start to notice that the memory feels further away from them. Clients start to notice that the memory doesn't feel as significant or painful. Clients start to notice that it's blurrier now, or it's behind a screen, or it's fuzzier. It's not as clear anymore. So it's further away, it's not as clear. This is the big one that clients realize. That had nothing to do with me. That's a big one, folks. It's the one that we tell ourselves all the time, but our body doesn't believe yet because it's still holding on to the trauma. It had everything to do with the person that hurt me. It had nothing to do with me. That's a big one that people realize so much of the time. In phase 5 installation, we are then pairing the adaptive positive belief with the trauma. So we are solidifying the connection that I can feel safe now. It didn't have anything to do with me. I can provide myself with healing. All of those empowering adaptive beliefs, we're solidifying that in installation by providing more bilateral stimulation and noticing how we feel when we bring that new adaptive belief in. So once you decrease the emotional charge in phase 4, you can bring in that positive adaptive belief in phase 5. Finally, the 6th phase, body scan, is where you are just checking to make sure there's no residual tension in the body from this trauma memory. If there is any slight pain left from the memory, we just do a few more rounds of bilateral stimulation to clear that up. We then move on to closure and reevaluation. Closure is where your therapist and you come up with a ritual on closing down a reprocessing session. So, this could be a mindfulness practice, a breathing practice. This could be talking about what you are doing the rest of the day to get you back into the day to day things that you're doing. It could be whatever you and your therapist like to do, or whatever you feel that would be most helpful for you at the end of reprocessing to close down that session. And phase 8 is reevaluation. This is just ongoing collaboration with your therapist. So, if you've been working on a memory for a little bit or a theme for a little bit, you talk to your therapist about where you go next in your work, right? So, there's still a lot of collaborating involved. And you're not going to do reprocessing every single session. You're going to process some of your insights from those as well, right? So, that's all in the reevaluation stage. By the way, folks, one of the things that I should say about that too is that even though your therapist is the one guiding EMDR, you are still guiding the process of therapy. right? That's where reevaluation comes in because I do make suggestions to my clients for what we might want to look at, but I want you to still be the center of the process, right? So all of your feedback is important for your therapist, right? So please, please, please tell them whatever you are noticing and whatever your insights are after you do reprocessing. This phase 8 is really, really important. So please remember that if you decide that you're going to search for an EMDR therapist. If you have a lot of traumatic events, RO asks, should you do this individually for each trauma memory or should you just do it for each theme? So, RO, that's a great question, actually, and it makes a ton of sense. Here's what you want to do you want to work on one theme at a time, and you want to do a couple of individual events within that theme, right? Because what that's going to do is, let me just flip back to my map real quick, because we were talking a little bit about this earlier. But what that's going to do is when you do these individual memories within a theme, it's going to start to create a flow of more memories from that theme that are going to naturally process because you've opened up that pathway for things to process in the way that they're supposed to because your body's feeling safer. So you work on each theme individually at a time, but you process a couple different memories within each theme until your body feels like it's clearer with those memories from that theme. So some themes you might only need to do like 2, 3 memories and you feel better. Other themes are maybe bigger or more painful. You might need to do 5, 6, 7 memories. It just depends on how much pain or intensity of pain is connected to that particular theme. That's a great, great question. Okay, folks, so I did mention earlier that recent studies have shown that EMDR is just as effective in online therapy as it is during in-person therapy. That is very, very true. It's also important to understand that some practitioners that do EMDR in person may not do EMDR in online therapy settings. If you ask me why that is, I can't tell you because that is preferences that I think individual therapists make. It could be because they only ever learn to do it in the in person setting, but I will tell you that most EMDR therapists that have been trained in the last couple of years, especially, are providing EMDR in the online setting because we learn about how to do that in trainings today. So that's important to note. If you would like to find an EMDR therapist, you can do one of two things. You can um, ask BetterHelp, the member support team, to see if there's anyone available in your state or country to access that has or that is practicing EMDR therapy right now and is open to new clients. They're really great at trying to get you matched up with your preferences. But if you either like your therapist here on BetterHelp and you just want an additional EMDR therapist, or there's no one available right now, you can also check out emdria.org. So I'll post that website here in the chat for everybody. That is the EMDR International Association. They have a Find an EMDR Therapist locator that works all over the world. So you can check those out as well. This website also has all of the latest research on EMDR, which is really great as well. Can BetterHelp therapists in the US work with a person in the UK? KY, sometimes they can. It depends on certain locations and certain licensing restrictions for both the US-based therapist and where the person is in the UK. Different regions have different rules and stipulations about that. There has to be some investigation as to where the therapist is, where the client is, to see if that does work out. Sometimes it can, sometimes there are legal or licensing restrictions preventing that, unfortunately. I mean, I hope that we move beyond that one day because we're a global world now and we can connect like this from anywhere. So I'm hoping that one day we kind of move beyond that. I do understand why it's there, why those restrictions can be there sometimes, but I think that given the access that we have, we could really be spreading this around the world in a very powerful way. Okay, folks, that's all that I have for you today. So thank you so much for all of your time and your wonderful questions and comments in the chat. You were an amazing audience. So thank you for being here. And by the way, if you showed up to all three of my classes today, please give yourself some congratulations because that takes some dedication. So thanks for being here. If you showed up for two out of the three, that's amazing. So thank you. And if you're just here for this one, I really, really appreciate it. And I would encourage you that if you love this class, to come back to some of my other classes as they pop up on your schedule in the future. I really appreciate every single person here in the BetterHelp community, all the time and effort that you put in to joining these classes and groups and making them possible. So thank you so much, everybody. Have a great rest of your day and a good weekend ahead, okay? Bye, everyone. Thank you so much. Bye. Bye, everyone. Thank you. Bye, everyone. Thank you so much. Bye bye. Bye, everyone. Thanks. Bye now.